So, good evening everyone. My topic is all about MICROTIA. So, first let's define what is MICROTIA. So, MICROTIA is a congenital deformity of the outer ear where the ear does not fully develop during the first trimester of the pregnancy. So, it has the abnormality in which the external part of the child's ears is underdeveloped and usually malformed. Also MICROTIA is described the outer ear, but it's often associated with the absence in the ear canal. So it's not only it talks about in the outer ear, but also in the absence of our ear canal. So it's called canal atresia or oral atresia. So it is a malformation of the external auditory canal resulting in the profound conductive hearing loss in the newborn baby. So, MICROTIA ears is vary in appearance and are usually smaller in size, often only consisting of a tiny peanut shape. So, it looks like peanut shape lobe ang common na MICROTIA. Then, it occurs about 1 in 5,000 births of baby, though rates can vary depending on the ethnic background. So, it has gamay lang siyang percentage nga ma-develop na ang ani nga bata ang naay MICROTIA. Then, in 90% of cases, it affects only one ear, usually the right ear, and it's more common in the male. So, in most cases of this MICROTIA, it's kasagara is unilateral gyud siya ma-develop. One ear lang siya and it is common in boys. Then there are 4 grades of MICROTIA. So the grade 1, the ear is smaller than the normal, but the key features of the normal ear are present, though they may have minor alterations in shapes or forms. So it looks like a normal ear but mas gamay lang ni siya kaysa ato ang normal but then ang iyang ear canal may be narrowed or missing yapon siya. And then for the grade 2, the bottom third of your child's ears, including the earlobe, may appear to be normally developed, but the top 2/3 are small and malformed. The ear canal may be narrowed or missing. So, ang grade 2 sad is normally develop ang iyang earlobe, but naa siya malformation sa iyang diri sa upper part. Then for the grade 3, this is the most common type of MICROTIA, in which the only feature remaining is a small peanut-shaped remnant earlobe. This is type of sometimes called globular type of MICROTIA. So the ear canal is usually completely absent. So kuan na lang siya, peanut shape na lang siya. Wala na kayo makita nga earlobe kay na-close na siya and iyahang ear na-close na gyud iyahang external ear. So for the grade 4, this is what we call the anosia. Wala na jud siya dalunggan. It is completely absence of the external ear without any remnant. So anosia na siya. But it is rarely seen in sa ato mga bata karon. Gamay ra jud siya percentage nga makita. So for the types, so mao ni siya ang normal ear. This is the type 1 or the grade 1 form of a MICROTIA. Pare-pareha lang siya sa normal ear, but gamay lang siya. Mas gamay siya kaysa normal nato nga dalunggan. And for the type 2, pareha ra na agyapon wala normally develop ang iyahang earlobe, but naano siya malformation sa upper part diri sa taas kaning sa murag na cartilage diri dapita. And then for the type 3, mao ni ang common nga microtia. It looks like a small peanut shape. So, ing ani na siya ang itsura. And for the type 4 is wala na gyud siya. Ano siya? It means no ear. So, to closely see the common microtia is mao ni siya. The type 3 or the grade 3 form of microtia. So, causes of microtia. Blockage to the blood supply due to the pressure from the positioning of the fetus against the inside of the mother or from the umbilical cord during the first trimester. So, makakos ay ang blockage of the blood supply due to the pressures of the positioning of the fetus. It can cause the underdevelopment of the external ear. Also, a drop in oxygen levels during the first trimester causing the ear to cease in development. So, lack of oxygen and drop of oxygen Japan can affect the development of the external ear of the baby. Also, ang common sa karon is sometimes it been linked to the drug or alcohol used during the pregnancy. So, genetic conditions or changes. Then, also po ang environmental triggers and a diet low in carbohydrates and folic acid. Then, also, one identifiable risk factor for microtia is the use of the acne medication called Accutane or isotretinoin. This is a medications to treat acne, but gina-intake siya sa mga pregnant, common sa mga pregnant, but dili din siya pwede kay isa din siya sa mga factors nga nung na abnormalities, congenital abnormalities nahitabo sa pagdevelop sa baby. And another possible factor is to put the baby at risk for the microtia is ang diabetes. If the mother is diabetic prior to the pregnancy, then mothers with diabetes appears to be the higher risk for giving birth to a baby with microtia than the with the other pregnant women. So, high risk ang mama nga naay diabetes to closely associate nga magkaanak siya nga naay microtia. So, is microtia is genetically inherited? So, in the most cases, microtia is not genetically inherited conditions for the most part. In most cases, children with microtia don't have any other family members with the conditions. So ma-develop siya during the pregnancy. So, it appears to happen at a random and has even been observed in sets of twins. The one baby has its but the other doesn't. So, dili siya maka-affect if na kay twins, then if ang isa naa, then dili siya pwede nga ang isa pod is pareha sila nga naa. Pwede ang isa na is wala. Kaya dili man siya maka-affect. It is not genetically inherited. So, ano siya? Although the most co-occurrences of microtia aren't hereditary, in the small percentage of inherited microtia, the conditions can skip generations. Also, mother with one child born with microtia have a slightly increased 5% risk of having another child with microtia. So, if naay possible nga ang mother makaborn siya with microtia, so gamay ra ang ma-increase niya. So, 5% lang ang risk of makakuha siya another baby with microtia. So, how is microtia diagnosed? So, pediatricians should be able to diagnose microtia through observation. To determine the microtia of your child's, the doctors will order an exam with an ear, nose, and throat. So it is an exam for the ear, nose, and throat specialist and hearing test with a pediatric audiologist. So observation, then mao ni siya ang mga test nga kuan sa mga pediatrician ginahatag nila sa mga marag na bantayan something ano. And it's also possible for the to diagnose the extent of your child's microtia through CAT scan or CT scan in short. And all CT scan or CAT is the same. It is a kuan ra ni siya kanang a computed gyapon tomography with image na siya, although it is but kani siya is mostly done only when a child is older or dagko na dili na siya capable sa mga baby. So next is you may also be referred to a genetic specialist if your child's doctor suspects that another genetic abnormalities may be at play. So if naay other factors dili lang ang isa imo, if ang imong doctor is naay other factors nga nakita sa imuha is pwede kaniya mahatag or then ay hatag sa laing doktor ay kaning ipa-diagnose basin di ay dili lang siya microtia but napajud ay kay another nga abnormalities, genetic abnormalities. Then treatment options. So first is the rib cartilage graft surgery. Rib cartilage is removed from your child's chest and used to create a shape of an ear. And then implanted under skin and site where the ear would be located, and the new cartilage is fully incorporated at the site. Additionally, surgeries and skin grafts may be performed to be better positions the ear. So, rib cartilage is kaning magkuha ka o mag-remove ka og something cartilage sa imong chest dakit or sa nose ba na magud siya types pod nga cartilage surgery. Pwede siya sa nose, sa imong chest or sa rib. Na siya para ipuli nga gamiton siya pang pa-implant sa imong dalunggan. Rib graft surgery is recommended for children 8 to 10 years of age. Rib cartilage is strong and durable. Tissue from your child's own body is also less likely to be slowly rejected as implant material. Then the Medpore graft surgery. This is type of reconstructions involved implanting as a synthetic material rather than a rib cartilage. So synthetic na siya. It can be usually be completed in one procedure and uses scalp tissue to cover the implanted material. So children as young as 3 can safely undergo this procedure. So kani siya is common din siya for the 3 years nga mga bata. The results are more consistent than the rib graft surgeries. However, there is a higher risk for the infections and loss of the implant due to trauma or injury because it's not incorporated with the surrounding tissue. So, gina-implant may synthetic na siya. So, unlike sa rib graft surgery is sa tuwa lang siya gikan, but kani siya is synthetic material naman gud ang ginagamit, ang gina-implant para mahimo dalunggan. Then the prosthetic external ear. So prosthetics can look very real and be worn with either an adhesive or through surgical implanted anchor system. The procedure to be placed implant anchors is minor and recovery time is minimal. So prosthetics are good options for children who haven't been able to undergo reconstructions or for whom reconstructions wasn't successful. However, some individuals have difficulty with the idea of the detachable prosthetic. So, mano siya, prosthetic na siya. Kabalon po siguro sa prosthetics. Ginagamit na siya. Then, The last is the surgical implanted hearing devices. Devices na siya. Vibration-inducing devices may also be helpful to enhance your child's hearing. This is worn in the scalp and magnetically connected to the surgical place implants. The implants connect to the middle ear and send the vibrations directly in the inner ear. So, surgically implanted hearing devices often require minimal healing and implantation site. However, some side effects may be present. This includes tetanus, nerve damage or injury, hearing loss, vertigo, leaking of the fluid that surrounds the brain. Kani magud siya high risk jud ni ang tetanus kay device biya ang ginagamit mo gina-implant nato sa atong kagalingan, but dayon what if dili biya siya connected sa atong tissue nga gikan sa ato, so high risk jud ni tetanus din ano siya. So impact on everyday life to the child with MICROTIA. So some children are with MICROTIA in the partial or full hearing loss in the affected ear, which can affect quality of life. Children with the partial hearing loss may be also develop speech impediments as they learn to talk. So, maano siya, makadevelop siya of speech impediments. Hindi magod sila makadangog. But, maano siya. Then, the interactions may be difficult because of the hearing loss, but there are therapy options that can help deafness. Deafness requires an additional set of lifestyle adaptations and adjustments, but these are very possible and children generally adapt well. So, maano ni siya, ang mga deaf nga bata is naga-learn sila ganing sign language so that we can communicate to them and we can maka-interact sa ilaha bitaw, like sila pod sa ato is maka-connect, dili lang marag sila ra, wala sila kasabot sa ato, wala sila madunggan sa ato. So that's all for MICROTIA. Thanks everyone. Thank you.